My name's John Lee, I'm the Chief Medical Officer. Many of you will recognize me, so I'm really pleased to be introducing this segment to you that hopefully is going to come frequently to the audience. I first wanted to start to talk about COVID, to give you a little update. I know that we give the updates in the press conference, but sometimes I don't go into as much detail in the press conference as I have time for. There are really big trials that are going on around the world, in particular one called the Recovery Trial in the United Kingdom. The great benefit of that particular trial is that because there is a unified healthcare system in the National Health Service there, they were able to roll out trial systems and processes right across the country really quickly and get answers rapidly to questions we wanted to know, like the benefit of steroids in treating COVID-19 disease. So that their ability has really shown the enormous capacity of an organization that size to answer questions that we need to know the answers to help people to get better. There is now, as we know, a lot of evidence that's coming out for treatments. I mentioned the steroids, but also there are other new treatments that are going into that recovery trial that will produce answers. But it's not the only place. The recovery trial actually has wings in other parts of the world, South America and so on, lots of different arms to that. The vaccines, as we know, are around the corner, and the Ministry of Health at the moment is finalizing our agreement with the COVAX facility, which is being organized by Gavi. Gavi is essentially an organization that is managing it for across the world, and it's been around in the vaccine industry. It's an international organization for a long period of time, for well over a decade. And COVAX is the facility in particular related to the vaccine for the coronavirus. We are being promised either in the last quarter of this year or early next year there should be a vaccine that's available. I really hope that comes to fruition. We've all seen in the press that there's been a hiccup in the Oxford trial in that they had to pause it for safety reasons. It now seems that the safety issue that they found was not related to the vaccine, so the vaccine trial is going ahead, so that's really good news. The plan is that we should order 20% of our vaccines for 20% of our population, which means we would order 2 doses, because most vaccines come with 2 doses. We all know that you have one, then you have another one maybe 6 weeks later to strengthen the immune response to the body. That 20% will be used in our most vulnerable and in the healthcare population. However, Cayman's in a really unique place for a couple of reasons. Firstly, we also have access to the United Kingdom. The United Kingdom has said that we would have access to the vaccines that they have for their population as separate to the COVAX facility that we're going into. So we've got another door to get hold of the vaccines. The other matter about the vaccines is that because we currently don't believe we have any coronavirus on the islands or not outside of our isolation facilities, we can require that everybody coming into the country would need to have a vaccine before they entered. So we could sort of like, our fence can still be up and our protection will be that certificate showing that you've had the vaccine. There are understandable fears about vaccines. I really do appreciate people's point of view, but that is why the manufacture of vaccines at a large scale for something like this is done with so much care and attention to look for any side effects, and which is why the trials that need to be undertaken to look for safety are huge. There are tens of thousands of people for every different vaccine. That is part of the safety of a vaccine. I suspect that when the vaccines come out, they may well not be recommended for certain groups of people initially until more information is conducted. So it's often difficult to do surveillance of vaccines in people who may be pregnant and in children, for example, because it's less, you need to be careful about exposing those groups in particular to something like anything novel that hasn't been tried in that group before. So we need to follow carefully what the people who are checking on the safety say about the vaccine as to which groups it can be used in. A lot of this is always about balance, like, is the likelihood of you developing a problem with the vaccine greater or less than the possibilities of you being affected by the virus, or you bringing the virus and affecting somebody else in your household? And that's a decision that is a really important one to bear in mind. It's not just about an individual, it's also about the community within which you're living and the close community in which you share your life intimately with.